Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Sharp, physical therapist.
Brad Heineck, physical therapist.
Because we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to self-massage the chest muscles. That'd be the pectoralis major and minor. Let's get into it, Brad.
That's right, Bob.
All right, let's talk about the pec major first. So here we have it depicted using actually tape, kinesio tape.
Well, this is Sam.
This is Sam. Hi, Sam.
Yeah.
So anyway, the muscles goes along the entire sternum here and half of the clavicle or the collarbone and comes over and attaches into a bump on your shoulder, the greater tubercle, if I remember right, Brad.
The humerus, yeah.
Yeah. So it helps pull the arm across like this. And it's nice to know which way the fibers are oriented because we're going to actually have you go against the fibers a little bit when you massage it.
Right.
So I think I'll talk about the pec minor too right away here, Brad. The pec minor comes from the 4th, 5th, and 6th ribs, I believe. Let's see, make sure it's 3rd, 4th, and 5th.
This is an anatomy test.
Yeah,
They'll be all right.
So and it comes up, and it actually attaches into the shoulder blade, the coracoid process.
Yeah.
If this is tight, it can pull the shoulder blade down and cause impingement.
Yeah, so it causes them problem with that mechanics of the shoulder. And this, just so you understand, we have lifted up the whole pec major. The major covers it.
Right.
So that's underneath the major. So it's deeper, and when you massage it, we have to keep that in mind.
Yeah, it's a deeper muscle, and you got to get through the skin too, obviously.
Yeah.
And if you have any fat there. But so first we're going to talk about how you know if your pec major is tight. When you stand, just stand and let your arms relax. If your palms are actually facing back because your pec major is tight and you're internally rotated at the shoulder, you're going to actually, the palms are going to face back. If you're in somewhat good posture, they should face towards each other.
Yep.
And
Thumbs forward.
I definitely have this tendency.
Many of us do.
Yes.
Especially if you do a lot of sitting, working at a desk, looking on your phone.
Well, if you live life,
yeah.
basically. So
nowadays.
Do you mind moving this out of the way?
Oh, absolutely. Here, let me have that, Bob.
So another way to show, this is from an old Kendall book, Brad. I don't know
Kendall?
what to call you. Yeah.
Ooh.
Florence Kendall. Do you remember her?
Oh, I thought you meant the digital books.
No. She would show this. If you want to check to see whether the pec major is tight, you just put your arms in a T position here. Mm-hmm. If you can't get your arms all the way down, it raises up a little bit here. It's tight, obviously. And also you can do it in the Y position. And now on the Y position, I feel mine is a little bit tight. You know what I mean? Especially this one doesn't pull down quite as well.
And that changes the fibers of that pec muscle. So we're probably looking more down here versus the fibers that go horizontal.
Yeah, definitely tighter on my left side. Final one you could do is you can actually put your hands underneath your neck like this, clasp them together, and see if you can bring your elbows down to the bed.
So there might be, this touch is good, but it looks like this one's a little bit higher.
Yeah, I've had trouble with this shoulder. It's because I had trouble with my serratus anterior. You guys don't need to know
the old serratus.
Yeah.
But my left side is even much tighter. Remember we did that test a few weeks ago.
Exactly. So there's a lot of different ways you can massage it. You could just take a massage ball. Do you have a lacrosse ball?
Yeah, use one of these.
So you can actually even just start by doing this, Brad. You can actually just take it and twist it.
I like this idea. We've got that other device that we just...
Yeah, that works good.
Yeah, we don't have it handy.
A little bumpy, you mean?
Yep.
That's what I use at home. I have one.
And actually, if I get
on
the skin, it grips in there better.
It's even better.
I'm not taking my shirt off to show you this. You just have to use your imagination.
All right. Next, you can actually lie on the ball too, and you want to do it on a hard floor. You don't want to do it on a mat like this. But I'm just doing it here just. I don't have to be on the floor, but you can work right onto that area, especially a lacrosse ball. And you can do it on the wall to start off with if you feel like it's too much.
You're gonna work that.
But you can definitely hit the tender spots, and if it's tender, it needs work. Now the easiest and best solution that we think is to actually use a massage gun.
Yeah. It is. It's just much easier.
It's much easier on your if you're going to use your own hands, you don't have to use your own hands. But
Right, which you're gonna use.
I like the big one.
Yeah. Now, I've had a shoulder chronic problem from swimming, and it lasted a whole year. Part of it was because 6 months of it with COVID, I couldn't swim. It kind of made it longer, but it only bothered me when I swim. But it was definitely a minor strain, and I believe it was in the Pec Minor.
Sure.
And this, I don't. What I do is, should I show how I got into it?
Yeah, why don't you show it, Brad?
Yeah, just you'll have to move, Bob.
Sure.
This is on the fly, by the way. But this is, I would lay down. I'm not in bed. I'd do it on a carpet.
lie down, Brad.
Lie down, and I would get in here, and I would work, and I could get underneath the Pec Major, and I could feel it hit that Pec Minor. It's gonna. My voice is weird because of the gun. And this is much better. At one point, I would get in here, and it's like, whoa, I would get right on it. But now it feels good. So things are much better now.
Brad, stay in that position for a second. I want to show how to tell whether the Pec Minor is tight.
Oh, yeah, that's a good idea.
So when you're lying down like this, and your hands are at your side, if this shoulder is raised up a little bit, that's a sign that the Pec Minor may be tight. Especially like this one's flat and this one's up a little bit.
Right.
That Pec Minor is pulling that shoulder blade up.
Yeah.
So
you have to have two people to assess that, obviously, but
this is more of an athletic massage gun. This is for
the bigger one.
Yeah, the bigger one. This one really does the job. I mean, these all work really well.
If you're an older person or you're thin, you don't have a lot of muscle bulk, I like this one.
Yeah, I do too.
Or this one, but that one,
I really
don't
thought
need that.
this was very powerful, especially for its size.
Yep.
But then I got this one, and it's like, oh my gosh,
Yeah.
this thing will blow your head off. It's
Well, I wouldn't
knock
use it
your
on my
socks off.
head, Bob.
Yeah.
Yeah, they are nice. So, yep, and I'll work it. I still work it, and I'll do different angles so I can get in.
Brad likes to go side by side across the fibers on the sideways like this.
Right, because the fibers are like this, and you're going to go across them.
Yeah.
And you'll definitely feel that tender, that tight spot where there's some scar tissue, because it's a little painful. So, you don't have to get really aggressive. You have to use your judgment on that.
Yeah, I think, on this, Brad, you need to feel a little bit of pain.
Right, I agree.
I mean, if you don't feel pain, actually none at all, it probably doesn't need massage.
With the exception, if you're going over a bone.
Right.
You never
right.
want to massage a bone.
Right.
So just to make that clear, because some people may not understand.
Right.
To us,
That's a
it's
good
very
point.
clear, yeah.
All right. This video, by the way, is part of a series of videos on massage. If you want to check out the series, go to bobandbrad.com, go to the program section. We have a whole bunch of programs there. Sciatica, shoulder, hip. We're doing a new one on the knee.
Right, tens.
Tens.
Yep.
Right.
So find the product or the problem that you have. If it happens to be working a massage gun under the shoulder, look at that. There'll be a number of videos. Different titles are about 10 minutes long each. You can go to the specific problem you're having, so you don't have to watch all of them. Look at it, and then there's a PDF printout button you can click on. Prints out, review, and exercises, pictures of the exercises of the video, and it's all right there for you. You don't have to search the internet.
All free.
Free, not even your email.
Right.
Yep.
We ask nothing of you, but you're thinking kindly of us.
Yep, and get better.
Yep. There we go.
Take care.